Good afternoon, everyone. We will get started here in just a minute. It's looking like we're reaching critical mass. So, okay, everyone, it's 2:01 and we've got well over 100 people. So it's numbers I was expecting. So thank you, everyone, for joining this afternoon. Just a couple of housekeeping items. The slides are actually currently available on HCI's Distressed Hospital Loan Program webpage. There is a link to that in the chat. So you should be able to scroll up to that and access that. We will repost it again later on in the presentation as we get towards the end. So the chat has been disabled for this meeting, but we will offer an opportunity at the end for question and answers. We will have a process where we will enable your microphone and you can raise your hand and then unmute yourself and ask questions. If you're interested in submitting written comments or feedbacks, we also have a tool, a Microsoft Forms tool, that is also linked in the chat, where you can click that link and it will give you a place to type in questions, comments, or feedback that you may have. And it will aggregate all of that in one place for us to receive it. And we will then, if people have specific questions specific for their hospital, we will respond to them directly. Otherwise, we will aggregate comments into some sort of frequently asked questions document, or in a future webinar when we release the loan application to start accepting applications. So I will remind everyone of the instructions later on as we get to the Q&A session. But with that, let's dive into things. So about us, I am JP Marion. I'm the Deputy Director of the Office of Health Facility Loan Insurance. You may be familiar with our flagship program called the Cal Mortgage Loan Insurance Program, which is a program that helps finance not-for-profit or governmentally owned health facilities to do construction projects for new or expanded facilities throughout California. So we are familiar with a lot of the names, and thank you for joining today. Partnering with us in this whole distressed hospital loan program is the State Treasurer's Office, the California Health Facilities Financing Authority, and I will turn it over to Carolyn Abu-Bashara to introduce herself.
Hello and good afternoon. Yes, I'm Carolyn Abu-Bashara, the Executive Director of the California Health Facilities Financing Authority, also known as CHFA, and we're assisting HCI in the implementation of this program, as well as we will be issuing the loans to the hospitals. I know many of you already know of CHFA or have worked with us in the past because we have a number of financing programs, most particularly our bond financing program that we work with a lot of the hospitals on, and several loan programs as well that assist health facilities. So yeah, thank you for joining us today.
So the purpose of today's webinar, we're going to give a little bit of background about the Distressed Hospital Loan Program. We're going to provide an overview of the loan application evaluation methodology, basically how we're going to analyze these loans and determine who's eligible to receive one. And then we also hope to obtain some stakeholder feedback on this evaluation methodology. And just want to let everyone know that we will do another informational webinar on how to apply once the loan applications go live in June. So a little bit of background. The intent of this program, as written in AB 112, is to provide loans to not-for-profit and public hospitals in significant financial distress, or to governmental entities representing a closed hospital uh, to prevent closure or facilitate the reopening of a closed hospital. HCI and CHAFA are partnering to administer this program, and HCI will be focusing on analyzing these loan applications, while CHAFA will be the primary point of contact and provide the ongoing loan servicing needs for the full life of the program. Loans will be interest-free, offering a 72-month term with an 18-month grace period at the beginning. We thought that it would be appropriate for once these loans are issued to have a bit of a grace period before a distressed hospital is required to begin repaying on them immediately, and give them some time to implement their turnaround strategies. Hospitals will need to begin repayment after month 19 and repaying over the rest of that 72-month term. Medi-Cal revenues will be the security for this loan repayment. In the event that a hospital is unable to make repayments, there will be a 20% clawback on the Medi-Cal check write on a monthly basis to begin repayment on these distressed hospital loans. As of right now, there is $150 million in one-time funding available. And as I mentioned, this program will be focusing on hospitals at significant risk of financial failure that have a viable financial turnaround plan. Again, interested hospitals will apply through CHAFA for these loans. In the evaluation methodology, we will be focusing on 4 main topics that will be of interest, which are liquidity, profit and losses, the turnaround plan, and community needs in terms of services and network adequacy. For each area, we have a sub-criteria that we'll evaluate, and we will apply a scoring methodology. At this time, we're still working on that scoring scales and weightings from within each topic area, and hopefully feedback from today's webinar will assist with driving that process. So right now, we're going to dive deeper into each of these 4 areas. So the first criteria that we're going to be looking at when evaluating these loans is liquidity. And the first sub-criteria that we're going to look at is days cash on hand. So we're going to be looking, is the hospital currently struggling with liquidity and in risk of running out of working capital to maintain operations, sustain services, or pay its employees? And the methodology that we're looking at will be a point system where hospitals that have fewer days cash on hand will receive more points and be given more consideration for a loan. Hospitals that have greater than 90 days will receive fewer points. So these ranges that were being proposed are based on a combination of factors. One is our experience working with hospitals through the Cal Mortgage Program. We've seen a wide range of hospitals from that are having financial performance issues through ones that are doing well financially, and we've seen that, that critical breaking point really starts to happen when hospitals are at 30 days or less cash on hand is when they're really at the fiscal cliff, so to speak. We've also done some research on hospitals that have public bond issues to see where their debt covenants sit. And those can range from 90-day covenants to 75-day covenants, 60-day, or even some have 30-day covenants. So we understand that, once you start bumping up against those bond covenants, that's when you really start to feel pressure from if you have long-term debt outstanding with other creditors. Also, just initial feedback that we're seeing from the interest survey. We sent out an interest survey on May 16th. I will speak to that a little bit later, but we're going to redistribute that survey after this webinar and to the hospitals. And if you haven't responded to the survey, I encourage you to please do so. It provides us with some valuable information on some things which I'll go over a little bit later in this webinar. So the next sub-criteria within liquidity that we're looking at is current ratio. Current ratio is focused on, is a hospital able to pay its short-term obligations with the current working capital assets that it has available. We see, current ratios of less than 1-to-1 are considered financially distressed. Those with higher than 1.5 are doing better. So we will be applying things on a point scale based on current ratio, with lower current ratios receiving higher points. Criteria 1.3 is access to working capital. So the intent here is that we're asking for hospital leadership to attest that they have exhausted all alternatives in looking for working capital assistance. We want to make sure that hospitals aren't sitting on an unutilized line of credit or able to get a line of credit or something from a bank. We know that a lot of you hospitals have already tried this, and that the banking industry is really stressed right now. So, this may be one of our lower weighted point systems, but we do want leadership to at least attest that that there's no other economically viable alternatives out there for them. Getting into criteria 2 now, we're going to be looking at profit and loss analysis. So first thing will be operating margins. Is the hospital experiencing operating or net losses? How long have those operating margins been negative for? We're going to be looking at the last audit financials and the current year-to-date financial statements. And we understand that, during the pandemic, financials for hospitals were very unique. There was some one-time pandemic-related funding and advances and things like that were distributed to hospitals. So if a hospital received anything like that, that can be excluded from the operating margin calculations. So obviously in the scoring, as the more negative and the longer that a hospital has been negative, will receive more points and more consideration in the scoring. Obviously, if the hospital is having positive operating margins, generating cash, then it will receive fewer points. Also, criteria 2.2, we're going to be looking at that impact of that operating loss to liquidity. So it's something we're calling net cash runway, or basically where we're focused on your cash burn rate. And if you're burning $500,000 a month in cash, how much runway do you have with your current working capital situation? How much runway do you have to continue operations before you run out of cash and need to close? Is that 6 months or less, 7 to 12 months, 2 years or more? The point scale will be weighted on the time frame of how long can you survive with your current liquidity situation. Obviously, the shorter will receive more points and more consideration for a loan. Criteria 3 is a big criteria. It is the turnaround plan. And the reason I'm showing the actual statute here is because I want to point out that it states that an eligible hospital shall submit a plan to the authority, which shall be shared with the department, with projections detailing the uses of the proposed loan and strategies proposed by the hospital's governing body to regain financial viability and continue to operate. So HCI is charged to review this plan and determine that the plan is viable before we can issue a loan from the program. So that's going to be kind of a key determination when issuing these loans. So a little more detail on that. We're going to work to provide an outline offering guidance to prospective applicants about what should be included in the financial turnaround plan. But on a high level, we want a 24-month cash flow projection accompanied by a narrative of leadership strategies to stabilize financial performance, how the loan will be utilized with the description of the change strategies to all revenues and expense assumptions. So if you're implementing some sort of strategy to cut expenses or shift services to enhance revenues, we'd like a description of that and to see how that works into your 24-month cash flow projection. Now, the reason we picked 24 months for the cash flow projection period is because that will assume the full utilization of the distressed hospital loan and account for that 18-month grace period, whereas in month 19, that assumes repayment begins. So in that 24-month period, we need to see how the loan is being utilized. And then in month 19, it needs to be assumed that the amortization of that debt service on this distressed hospital loan will kick in and repayments will start being applied to that. These turnaround plans from the interest survey that we've seen thus far, many of you have already addressed this matter with your board governance and have a head start on this item. So that being said, it is a lot of work to put together one of these turnaround plans, and how we'll be looking at scoring them is we'll be reviewing the plans, looking at the cash flow and the strategies that are being proposed, and plans that demonstrate a return to financial stability with no or limited changes to services, and being able to begin remaking payments on the loan will obviously receive more points than a plan that doesn't. Maybe a plan involves making some major changes to service lines. Maybe it's maybe you have to are proposing cutting services to regain profitability. Therefore, that might receive fewer points. It's possible that a plan that you don't see a return to financial viability on your own, and maybe you have to engage in some sort of process where you're looking to sell to another hospital or partner or merge. Um, while that is a potentially good plan, it may receive fewer points if the likelihood of that happening is lower. If you have some sort of negotiated deal already in the works that has a high confidence of coming to fruition, then we can assign more points to that. So there is going to be some subjective criteria here around these turnaround plans, but hopefully this kind of provides you with a gist of how we're going to be evaluating them and scoring them. But these will be a lot of work to put together, and understanding that, with that in mind, I want to take a bit of a flash poll on this topic. So keeping in mind the specific needs to fill out an application, create this turnaround plan. Your every organization is different, but I know for hospitals such as district hospitals or public hospitals, you may need to post an agenda, and you're subject to Bagley-Keene or Brown Act rules where you have to post an agenda 10 days in advance, host a board meeting, request permission from your board to apply for this program to take on the additional debt, get the necessary approval or resolution from your board authorizing you to take on this loan, any public meeting timeline requirements. So assuming that that this loan application is able to go live in the first week of June, we'd like to know ideally how long you will need to prepare, so that way we can determine what a goal date is for a funding round. Our intention is to not make this process first come, first serve, but we are striving to distribute funds where needed as quickly as possible. So I'm going to release a poll survey, and but before I do, I'm asking everyone politely, please, if you are not a hospital or staff representing a hospital that will be doing this, please refrain from responding. We really want to keep the data clean and hear from the hospital staff that on how much time they will need to do this process. So with that, I'm going to launch the poll here. Give it just a little more time here. We've got 41 responses thus far. Okay, I will let that run, and I will continue on to our next slide. So criteria 4 is the next criteria topic that we're going to be looking at. And it has to do with, in general, community need. And basically, what the impact would be if your hospital were to close. So what are the access to care impacts for the provider network and the service offerings in the community if the hospital were to close? So we'll be looking at something, the first criteria will just be what other hospitals are around the area. Obviously, criteria like if the nearest hospital is greater than 15 miles or 30 minutes driving time, that may be a hospital that receives more points, more consideration. If there are multiple alternatives nearby offering similar services, then that would receive fewer points, less consideration. Criteria 4.2, the hospital is planning to eliminate needed lines of services in the community. Within your turnaround plan, that will be we'll be looking at that to see if that's a proposed strategy. If the hospital is not considering eliminating lines of service, is able to keep everything open and operating, offering those services to the community, it would receive more points, more consideration. Obviously, if a hospital is looking at cutting needed lines of services in the community where there are not a lot of alternatives, then something like that would receive fewer points or less consideration. Third, we will look at basically your service area designation. So every hospital is located in a medical service study area, and we will simply be using HCI's tool for this on its website to confirm what a hospital's designation is. So it will check the designation of applicants. Is the applicant in a medically underserved area or medically underserved population? A hospital that is in both may receive more points. One that's in one versus the other, less points. And then if you're not in a underserved area or underserved population, you would receive the fewest. Lastly, we are also looking at community need, the payer mix within the community. What's the hospital's payer mix? Is it predominantly Medi-Cal, Medicare, underinsured, or discount or charity care? The greater the payer mix with those items, the more points and more consideration that will be awarded. The fewer the points will go to those with lower payer mixes of Medi-Cal, Medicare, uninsured, discount, or charity care. Going back, I forgot to mention something on the service offering. Something else that we'll also consider in there that we're looking at and still putting under consideration is things like if you're considered a trauma center and the nearest hospital is not, that will also factor into the scoring on this. So that covers the 4 primary topic areas that we're going to be looking at. There are some other factors that won't necessarily be scored, but there will be questions about this in the loan application, and it will be important for us to know when the time comes to issue a loan and create those transaction documents. But is the hospital in technical or payment default with long-term debt covenants and with existing debt? And is the lender that you currently have implementing remedies of default actions? That will be important for us to know. Also, has the hospital already pledged Medi-Cal revenues to its creditors? Therefore, that would make the collateral source for this loan potentially subordinate to an existing revenue pledge. It doesn't preclude you from receiving a loan, but it's just something we need to be aware of in terms of when it comes time to issue these loans, and in the event that there is a catastrophic scenario and there are other creditors looking at those revenue streams. So the timeline of things going forward. So I mentioned at the beginning that we distributed an interest survey on May 16th. We sent that to the CEOs of all the hospitals that were identified by the basic eligibility criteria for the in the statutes of AB 112. So it's not for profits, governmentally or owned or public hospitals, municipalities, UC owned, that have fewer 2 or fewer hospitals in a system. And so all hospitals CEOs received an email from us on that. If you didn't get it, check your junk email folders. It might be in there. However, we are going to redistribute that survey after this meeting, and we're asking for hospitals to respond to this survey by the close of business tomorrow, Wednesday. What we're gathering from this survey is some basic information, just your basic current liquidity situation. Are you interested in a loan through this program? If so, ballpark estimate of how much. That way, it will help us determine how oversubscribed we are. Do we need to cap loans at some amount? How we will size these loans going forward when it's time to distribute them. So please fill out the interest survey. Again, we'll redistribute that after this meeting. We also have a website, and feel free to go to the Distressed Hospital Loan Program website, and there is a email address how to contact us. If for some reason you're not receiving the survey and you really want to fill it out, you can reach us and we'll make sure that you get a link. Later this week on Thursday, the CHAFA has a board meeting where they will look at this draft criteria as well, and hopefully approve the authorization of loan administration for this program. We're also targeting to try to get loan applications to go live for submittal in early June, targeting that first week. And at the same time, when we release the loan applications, we will also do a follow-up informational webinar where we may answer any follow-up questions that we receive here today, or also provide information about how to apply and any other information that may be valuable in the application process. So at this time, you can raise your hand to ask questions, and someone will enable your microphone. You may still need to unmute your microphone if you are on Microsoft Teams. If you've called in and you've reached us through your cell phone, please dial *5. That will raise your hand. And then once the host has enabled your microphone, you can dial *6 to unmute yourself. So *5 and then *6. Also, our preferred method to receive written feedback right now, just because the chat can become a little unmanageable, and the best, easiest way for us to compile questions that we need to answer and feedback is it's through a Microsoft Forms page that we've set up. So in the chat right now, there is a link to a Microsoft Forms page that will offers you some fields, free form fields, to where you can type in questions or comments or feedback about this methodology, and we can respond to that. If you have a specific question about your specific hospital, we can respond to you in private directly. Otherwise, themes and questions we can respond to in a frequently asked questions document later, or we will address them at the next webinar that we do. But and we'll keep that Microsoft Forms link open through close of business tomorrow. So you don't need to feel like you need to reply this instant, but we would appreciate any questions or feedback by end of business tomorrow. If you miss the link, if you're calling in through a phone and you don't have access to the link in the chat window here, this PowerPoint slide presentation is available on our website, and it has a link at the end to this Microsoft Forms page. So that's another way to access it. So at this time, Joanna, if we have hands raised, you can feel free to enable them and fire away.
Hi, this is Nia with Assemblyman Vince Fong's office. I'll go ahead and take the first question.
Okay.
You had mentioned, first of all, thank you very much for doing this webinar. It's very helpful. On the question about Medi-Cal being already pledged for another creditor, can you
Explain that a little more.
Yeah, talk a little bit more about that, and then also how will you score that?
So that's not something that we're necessarily going to apply scoring criteria to, but it's just something that we need to be aware of when we're doing the loan agreements and promissory notes and things like that. But basically, what the issue is some hospitals that have bond issues or bank loans and things like that, it's very common to give what's called a gross revenue pledge on those. So if a lender has to take in remedies of default or possibly foreclose, a different lender may already have claim on those revenues. So it's not necessarily something we're going to score on, but it's just something we're going to be aware of.
Okay, and so that shouldn't have a negative adverse effect on an application?
No,
Okay.
it's nothing that would preclude a hospital from getting a loan.
Okay, thank you very much.
Good afternoon. This is Chad Mulvaney with the California Hospital Association. Just wanted to make one comment and also wanted to thank you for taking the time to go through this certainly very important work. I appreciate that part of the criteria, both under the community scoring element and then also under the turnaround plan, involves service line closures or reductions. However, I think it's going to be challenging for a hospital to put together a credible turnaround time or plan unless there is some change in service mix. So I think having it double weighted and giving it incrementally or more weight is going to be challenging in terms of putting together both a turnaround plan that works, but then also qualifying for the loan.
Thank you, Chad. Definitely something we're considering. We've seen that in our development, and it's something we're considering. I will take your comment, and as I confer with the team going forward, we will definitely put that in our consideration. Thank you.
Thank you. Appreciate your time.
Hello.
Hello.
Hi, this is Karen at Madera Community Hospital. Again,
Karen.
Thank you for putting this on. It was very informative. I just have a question. Is this program designed to exclude closed hospitals? Are hospitals that are standalone like Madera able to apply for this loan?
Yes. Yes. The hospitals, basically, the law provides that if a hospital closed after January 1, 2022, it is eligible to apply. Your turnaround plan, when it's submitted, should include some things such as what are going to be your strategies and things with like restaffing, and are there any specific facility challenges that may come up with reopening? But no, closed hospitals are absolutely eligible to apply.
But do you have to, because it said somewhere in your presentation that you have to be a governmental entity if you're a closed hospital to apply for the funds.
I'll need to confer with um, you know legal and some of the policymakers on that, on how that works. I specifically know the sentence you're talking about, but I believe the intent is to help a hospital reopen. So
Okay.
we will I'll confer with the powers that be on that, and we'll figure out how we can help.
Yeah, and I have just one more question on
Uh-huh.
the secured Medi-Cal and the security, for getting the loan. Is that 20% taking off the top when you first apply for the loan, or is that at a later time?
No, that's at a later time. So let's say you're in month 19, and you're still struggling, and you are not able to fully make repayments on the loan. What'll happen is the CHAFA will have the authority to your monthly Medi-Cal check write revenues that you receive. CHAFA will have the ability to basically take the first 20% of that to be applied towards repayment.
Thank you. I understood that. I just wanted to clarify it wasn't, in the beginning. So thank you. That's all my questions. Appreciate it.
Yep. Thanks, Karen.
Good afternoon, JP.
Hi.
Hi, I have a quick question. I'm from Santa Clara Valley Healthcare.
Uh-huh.
And I wanted to confirm in some of the documentation, it talks to hospitals under one license, and we are that type of an organization. I just wanted to confirm. Although we have several locations, we are all operating under one license. And so are we eligible for this program?
Not sure I can answer that right now. I think that's something where I'll need to confer with our counsel to make sure the situation, double check your licensing situation. But I know that that from what I understand, the intent of the bill is to hospitals that had more than two hospitals were ineligible. I'm not sure about the specific under one license rule. So that's something I'll take note of, and we'll have to get back to you.
Thank you.
please check if you've got your hand raised. Please check to see if you can unmute your mic, and if you can, go ahead and fire away. Looks like maybe, I'm sorry if I pronounce your name wrong, Nisette Short.
Set the microphone is enabled, so you would just need to click unmute in the top right-hand corner of your Teams screen so that we're able to hear you.
Okay.
Looks
Looks
like
like she put her hand down. Karen Palinelli, do you have another question? Looks like you still got your hand raised.
I do have another question. Thank you.
Yeah.
I was just wondering about the 2 or more hospital scenario. Is there any flexibility in that? Let's just say there was a potential partner, and if they had and owned 2 or more hospitals, would that automatically cancel out the ability for us to try to apply for this loan or them?
You pose an interesting situation. I'm not sure of, Karen, but definitely something I will jot down, and we'll have to talk with counsel about that and see. I know as the law is written, it's 2 or more to apply for a loan, so we'll have to look into that. But thank you for alerting me to it.
Thank you.
Okay. Looks like Lex.
Can you hear me, JP?
Yeah, there you are. Hi, Lex.
Okay, thank you. Hi, this is Lex from St. Rose Hospital. If most of us who qualify and meet the criteria apply for the loan, when the distribution takes place, is there going to be enough for those of us that apply, or be enough to sustain the operations with the amount of loan granted?
So that's the goal, is to, we're really trying to figure out the sizing of the loans right now, and the interest, and focusing on the hospitals that are, for lack of a better term, closest to a catastrophic scenario. And so, it can't be guaranteed that, every hospital that applies is going to get something. But our goal is to, when looking at the sizing, to be able to give enough of a loan in terms of that cash runway that I talked about, to give you at least like a year's worth of a fighting chance to implement your turnaround strategy.
Okay, thank you, JP.
Yep. Still got about 10 more minutes, but if anyone wants to raise their hand and speak up, feel free. Otherwise, there is that Microsoft Forms link that you can click on, and provide written questions that you may have.
Hi, it's Karen again, and
Hi, Karen.
I was under the understanding that $150 million is available this fiscal year, and I'm just wondering, will that automatically renew this next fiscal year? Because I mean, obviously, the loan application's not gonna be out till sometime in June. It's gonna take some time to get a turnaround plan. And folks, I guess, have to decide, first of all, it's expensive to work on a turnaround plan to get submitted. And there's, a lot of people on this call, and the $150 million, divided amongst, the point system of the people that might, you know, decide to put in an application. Just, I guess I'm just trying to understand how is that all gonna work? And
Sure.
I understand the point system, but there's only $150 million, and I see a lot of people on this call, so just curious.
Yeah. So to answer your first question about the 150 million, so that's one-time funding. It is continuously appropriated to where, if we don't get the money out by June 30 of 2023, it rolls over and we're able to pay it out in next fiscal year. But that being said, as of right now, there's no additional funding anticipated for this. It's just 150 million one time. So in terms of the point system, yeah, that's the challenge that this program has, and what HCI and CHAFA have to figure out is who's in the most critical need, and how we can distribute this money to help the most hospitals that are kind of closest to that fiscal cliff.
Thank you.
All right. I encourage anyone to raise their hand if they have any further questions. Otherwise, we'll just give it a minute. Again, look for the interest survey. Please fill that out. Go to our website. You can get a link to the Microsoft Forms where you can leave feedback and ask questions in our PowerPoint presentation. But looks like we have one hand raised. Jane, can you hear us?
Yeah, hello, this is Jen Zhang, CEO of Chinese Hospital. I have a question that most of the hospitals are probably rural hospitals, but there's some independent hospital, very few in the metropolitan areas. Are you going to use the same criteria to evaluate the applications?
Yeah, the criteria isn't going to be specific for rural or for or urban areas. The one thing that will come into play is kind of the if you are in an area that has a lot of alternative um, services, other hospitals nearby that offer similar services, you may not score as strongly on that particular criteria as a hospital that may be a safety net provider in a rural area.
Got it. And the other question would be, some hospitals are more culturally sensitive, provide culturally sensitive and linguistically appropriate care to certain communities. Will that be considered?
We will take that into consideration. Thank you for raising that point, providing that feedback.
Thank you.
All right. Well, for those of you left on the call, I really appreciate your attendance and this feedback. And here are some ways to get a hold of us. Our email address where you can send a question to the program, dhlp@hchi.ca.gov. Please go to our website and you can learn more. With that, thank you all. I appreciate your attendance.